This is week 12, prenatal diagnosis of chromosome abnormalities, part 2. Microdeletion syndromes are caused by chromosomal deletions smaller than 5 million base pairs, spanning several genes, that are too small to be detected by conventional cytogenetic methods or high-resolution karyotyping. The larger chromosomal deletion syndromes, such as Cre-de-Shah, are detectable using karyotyping techniques. However, the detection for the microdeletion syndromes is done by fluorescence in situ hybridization or FISH. I want to start off by looking at Smith-Magenis syndrome, which is due to an interstitial deletion of chromosome band 17p11.2, which is comprised of approximately 25 genes. The majority of the cases are sporadic. There is failure to thrive in infancy and postnatal growth deficiency. There is infantile hypotonia, and the IQ of the individuals with this syndrome usually fall between 20 and 78. However, the majority fall between 40 and 54. They have dysmorphic craniofacial anomalies, including downturned upper lip, pronathia, and low-set ears. They have short, broad hands and short fingers, and they demonstrate cardiac, vision, and hearing defects. Please go to this video and you can see Smith-Magenis syndrome. Neurofibromatosis type 1 is a defect in the protein neurofibromin that normally suppresses activity of a gene that causes cell division, leading to abnormal growths of café-au-lait macules, which are pigmented skin patches, and neurofibromas, which are benign tumors of the nervous tissue beneath the skin. It is an autosomal dominant disorder. There is variable expressivity, and the gene for neurofibromatosis type 1 is located on chromosome 17. Many children with neurofibromatosis type 1 have larger than normal head circumference and are shorter than average. Nearly 50% have speech problems, learning disabilities, seizures, or hyperactivity. Please go to this video to view neurofibromatosis type 1. In neurofibromatosis type 2, it also is an autosomal dominant disorder. However, the gene is located on chromosome number 22. It is less common than type 1. Tumors in the tissue around the 8th cranial nerve, called vestibular schwannomas, occur in neurofibromatosis type 2. A hearing loss or deafness or ringing in the ears, tinnitus, occurs in this disorder. Tumors in the spinal cord can occur, and meningioma, which is a tumor on the membrane that covers the spinal cord and brain, or other brain tumors, can also be present. Cataracts in the eyes in childhood are common. There are balance problems, as well as weaknesses or numbness in an arm or leg. Please go to this link, which will show you some information on neurofibromatosis type 2. Meeker-Decker syndrome, MDS, is also called 17p13.3 deletion syndrome, and it leads to a partial monosomy. There may be an unbalanced translocations that occur, 17q, 17p, or 12q or 17p, or the presence of a ring chromosome 17 in this syndrome. It's characterized by congenital malformations detectable in an infant at birth, which can involve many different parts of the body, including the brain, heart, lungs, liver, bones, or intestinal tract. The brain is abnormally smooth with fewer folds and grooves, the gyri and the sulci. The faces, especially in children, have distinct characteristics that include a short nose with an upturned nares, thickened upper lip with a thin vermilion upper border, frontal bossing, small jaw, low-set posteriorly rotated ears, a sunken appearance in the middle of the face, widely spaced eyes, and hypertelorism. Also, the forehead is prominent with bitemporal hollowing. Please go to these two links to access the two videos on Miller-Dieker syndrome. Rubinstein-Taybi syndrome, RTS, involves the chromosomal segment 16p13.3 and is characterized by mutations in the CREBBP gene, which makes a protein that helps control the activity of many other genes. This syndrome is also known as broad thumb helix syndrome or Rubinstein syndrome. Individuals who have this can have congenital heart defects, short stature, moderate to severe learning difficulties, distinctive facial features, and broad thumbs and first toes. Other features of the disorder vary among the affected individuals. People with this condition have an increased risk of developing non-cancerous, benign, and cancerous tumors, leukemia, and lymphoma. It is an autosomal dominant disorder, and it can occur sporadically. Please go to this site to view Rubinstein-Taybi syndrome. Wolff-Hirschhorn syndrome, WHS, is where you have a chromosome deletion at chromosome number 4, deletion 4p16.3. The other names for this disorder are chromosome deletion Dillon 4p syndrome, Pitt-Rogers-Dank syndrome, PRDS, or Pitt syndrome. 87% are de novo mutations. Some are derived from translocations from either parent. The features include a distinct craniofacial phenotype, which can include microcephaly, micrognathia, short philtrum, prominent glabia, ocular hypertelorism, dysplastic ears, and periauricular tags. There is intellectual disability in this condition, as well as hypotonia, seizures, and congenital heart defects, and deficiencies in antibodies are common. Please go to these two links to go to the videos which show Wolff-Hirschhorn syndrome.